So you're a big fan of spinal decompression. Who's a candidate for that type of procedure? And how does it work?
Well, I am a big fan because for the right candidate, spinal decompression yields amazing, effective, and long-lasting results.
Okay.
First of all, you've heard of slip discs or herniated discs. Disc is bulged out, pushing on your spinal cord or the nerve. It works great for those people. So
that's what's causing the pain?
Then that's what's causing the pain.
So when you hear a slip disc, the disc is
pushing in on the nerve. Yeah.
Okay.
Yep. Other people can have something called stenosis. You notice they're bent over, bending forward, trying to get away from the pain. And they have a lot of good results from that. Again, why? Because the bone is now shaving up and pushing against the nerve and causing them pain. Okay. And then there's something in your spine called hinges. Well, they're called facets, but they're the hinges of your spine. Imagine as we get older, they get a little bit less flexible than they used to be, and the capsule's there, and that bone rubs against it. So if you've heard you got facet syndrome, works really great because it stretches and opens, and stretches, opens, helps them revigorate.
So most of everything that's done in orthopedic surgery and spine surgery is to take these, shave the disc or move the discs away from the nerve.
Yep.
So what are you able to do non-surgically? Help me understand that part.
So we're able to move the disc away from the nerve so it doesn't cause pain, and help the disc itself get itself back to life.
Okay.
If we're doing surgery, there's some discs that are so bad that they have to stay that way and you got to do surgery. But otherwise, you're cutting in. You're changing the architect. There's not the same muscles. One surgeon told me they have to cut some surgeries. They cut 5 or 6 muscles inside the spine, and they never put them back on. Well, of course that person's probably going to have dysfunctions. Yeah.
Okay.
So we get to let you avoid that. And
so they lay on this table.
Yeah.
And they're kind of like, their spine is stretched out.
So,
because I've seen some of your videos.
The machine actually has sensors. So our sensors are checking about 100 times a second to make sure if you move more than 10 pounds per square inch, it is actually that sensitive.
Okay.
So it slowly and gently pulls to open up the spine. So we have to strap it, like if we're doing low back, we're going to hold your hips. We're going to have one strap right here with the sensors, and then we're going to target exactly where we want to target, so that way we can do the therapy there. As it starts to decompress, the disc gets pulled off the nerve, and the pain begins to go down. And then we're able to start bringing the inflammation down to those means.
So how many treatments for spinal decompression work?
At the minimum I've seen is 10, and they got to be consecutive. I like to treat 3 times a week, have them on there 3 times a week, but I think 2 is probably minimum.
So what is it doing to the disc? How's it helping the disc? Help me understand that
Well, what's happening is actually it's drawing fluid into the disc. As it expands and closes, discs live by getting that nutrition through that imbibement. So it actually helps the disc get a little more fluffy and actually have more padding in there.
Can you show on X-ray that the discs get bigger? Because I guess as you get older, they flatten out a little
bit. That's what we end up doing. If someone does a full program with us, which might be 30 treatments in order to get that, then at the end, that's what we do. You take an X-ray or MRI so we can show them what changes we've actually provided.
Can you do it on a person in their 70s?
70s, yes. It changes for when we get up to the different ages. They might be, their pain is better, but their disc didn't grow as much as somebody who's only 50.
Does it hurt?
No, we try to, it's actually...
Does it feel good?
Well, to be honest, it feels good when you're on there. Let's say you're in 10 out of 10 pain though, and I put you on there, you feel like it's a 5. Then you get back up the very first time, it goes back up to a 7. Well, that feels like hurting. Okay. Then we come in next time, you're at a 7, it's out of 10 pain.
But during the procedure, it's not
it should
painful.
be painless. It should be pain-free. Yeah. And for some people, we'll put a little heat pad under there, or we could put things to help them. And I need to mention this. We do decompression in coordination with other therapies. So if we're going to decompress, we're going to add the hyperbaric oxygen. We're going to add the laser. We're going to end up doing CBD or kinesiotaping. So that way you're getting multiple modalities. CBD is basically it's a non-THC version of the cannabis plant.
Okay.
Doesn't have we don't use the active. Yep. So that way it helps decrease the pain while the patient's going through therapy.
Will they do like physical therapy as well and chiropractic? Because you have access to all that in your...
And so that's what I mean. We actually do all of them. So you're not going to just do one single modality. We're going to actually combine the PT, the chiropractic, the laser, the decompression, stem cell, PRP if you need it. Like the whole shebang. Why? Because we're after people who've already had surgery, tried everything else and it didn't work. And so if someone goes, well, what if you start a little? Why would I do that? You already went through everything. Your surgeon already told you can't fix you. So what we're going to do is we're going to start from ground up and we're going to try to rebuild your body. We call one of our therapies the Lazarus plan. Okay. I'm not the, you can tell I'm a little bit on the spiritual side, but Lazarus rose from the dead and it's like, hey, I can't walk, I can't feel my feet, my pain is 10 out of 10, I can't do anything. Lazarus, we're going to end up needing to have our surgeon, our orthopedic surgeon look at the stem cell or the PRP, our nurse practitioner look at the hyaluronic acid, our laser tech do laser, our decompression person do decompression so we can open up that joint. We're gonna have to do it all points bulletin and then use, electric nerve therapy in order to bring down and change that brain pattern.
Now, I know you reduce a lot of pain in these people, but do you ever have people that say, I'm pain-free?
That's the goal of everybody. So we have a lot of people who are end up being pain-free. I like to keep things and tell people, hey, if you're a 10 out of 10, what I'm promising you is a bad day will be a 2 or a 3. So pain-free is a very great goal. And a lot of people, we do get them pain-free.